Good morning, everyone. I'm really excited to talk about the research project I've conducted for the past 2 years in order to develop a technology for rapid detection of airborne pathogens. The team I've been working with is made of mechanical engineers, bioengineers, molecular biologists, and marketing specialists. All people with a variety of backgrounds, all of them needed to succeed with this type of projects. The first question you could have is, why did we focus on rapid detection of airborne pathogens? Well, as all of us unfortunately know, a devastating pandemic hit this country 2.5 years ago, showing how vulnerable this country is with respect to airborne pathogens. One of the most unexpected consequences was that the places we were considered the safest ones were not safe anymore. I'm talking about hospitals. There were many people who went to the hospitals, got COVID there, and they never made it out. This is not an isolated news. There have been many news like this one during the entire pandemic from all around the country. And only a few months ago, January 2022, we hit a record of number of patients contracting COVID at hospitals. Let's look at the data. As you can see, for the entire time of the pandemic, there have been many people contracting COVID at hospitals. So now the question is, how do you win a war against an invisible enemy like COVID? Well, the answer is simple, by acting early. And how do you act early? This answer is also simple, by early detection. And this is what we do. We are developing a compact, automated, integrated device that can detect meaningful concentration of airborne pathogens in almost real time. We are talking about a process that is going from aerosol sampling to virus detection in around 20 minutes. And based on our experimental data, right now we can detect influenza and COVID concentration at the lowest end of the concentration detected in hospitals. However, this type of device could be easily readapted for any type of virus whose genetic sequence is known. Think about having this type of device in this room, on these tables, or going around this room on a Roomba robot. Well, if someone was sick, probably this device would have sent out a signal telling us, even before the end of my presentation, that the concentration was high. At that point, we would have left the room, and we would have spent only 30 minutes in this room instead of hours, reducing the risk of getting infected almost to zero. Well, if this type of early detection was available 1 year ago, 2 years ago, or even a few months ago when we saw this record, we would have seen, based on our model, a totally different scenario. We would have seen a much flatter curve that corresponds to many less patients contracting COVID in hospitals, that corresponds to many less deaths. The market opportunity is really large. And as beachhead markets, we identified hospitals, but also nursing homes, where there are many vulnerable people. However, based on many interviews we have already conducted, there are so many customer segments that would have an advantage of having this type of device. We're talking about schools, we're talking about Department of Public Health, we're talking about airlines, cruise ships, and actually anyone who has an interest in monitor air quality. We are already envisioning future generations for this device. The first one will be an integration of our device in other standalone units, like air purifier, in order to have a broader adoption of our device. The next one will be integration of this device in HVAC system, so that we can monitor and control an entire building. In terms of next steps, what we want to do is to finish our optimized proof of concept prototype in order to conduct tests in simulated environment in our lab. In the field, in many hospitals who already pointed out their interest. And then we are planning to spin out from MIT in 1.5 years, and then find potential industrial partners in order to scale up the production and start working on generation 2 and 3. With this final slide, I want to thank you all for the attention, and I want to invite you to come talk to us either at the poster or during lunch. We look forward to hearing from you. We are actually mostly interested in possible introduction to hospitals and nursing homes to find other partners for our pilot tests, to cruise ship and airline companies to continue the validation for this customer segment, and then we are always looking for industrial partners and possible investors. I want to finally thank the Deshpande Center, the US Air Force, the I Corps, and the Engine at MIT for the support that they provided for our research. Thank you very much.